Yes, sir.
Okay. Assalamu alaikum, students. Today we have a very important topic for the lecture to discuss here. And you all are aware that in the third years, you have been exposed to choosing a topic and writing your own manuscript for publication. That manuscript is expected to be published in some good journals, maybe national journals or the international journals. A publication on your CV will add much to your career and will boost your CV to for you to be selected in some good institutions, both nationally and internationally. So, manuscript writing and medical writing is important for any medical student. In this context, we will discuss the core components of the manuscript and especially writing the introduction. So within the manuscript, there are many other sections, but we'll focus our lecture on introduction section. So my name is Ashraf Jahangeer. I'm an assistant professor in the Department of Community Medicine, Dow Medical College, and I'm an epidemiologist and public health physician. Uh, my interests are undergrad and postgrad teaching, research, both undergrad and postgrad, and particularly I'm focused on the maternal and child health and injury prevention. So moving on to the lecture objectives. Um, In this lecture, we'll focus on the introduction writing with a perspective of how to structure the introduction section, how many paragraph would be there, and what each paragraph means for the very topic. So first, we'll after attending the lecture, you will be able to analyze the paragraph structure of introduction section. Second, we'll see what different types of scientific writings are. Medical writing, the types of medical writing, or the classification of medical writing. And in this context, uh, we'll see what is the difference between scientific writing and literary writing for literary purposes. You all have exposure in your previous education for writing essays and other writings for magazines and non-medical writing, and those type of writings are different from the writing we are going to discuss today. So mm, for the publication purposes, scientific publication purposes, you need to you need to be more scientific in your writing, more logical and neutral, and to be very concise, precise about what you want to write in the minimal word count. One thing. So the third objective for this lecture would be to enlist the different types of introduction writing. So within the within the introduction writing section, you may encounter introduction for the purpose of a protocol or a synopsis, or maybe introduction of a literature review or introduction of a medical paper. So because each of these um, each of these tasks has different purposes and different conditions. By conditions, I mean they require um, there may be certain limitations, such as for the for writing for the publication in some good journals. Most of the journals restrict you to 3,000 words. In that context, you cannot write an introduction more than 1,000 words. So you have a limitation of writing an introduction under 1,000 or maybe within 500 words. Similarly, for while writing for some review papers, not an original research article, but for review papers where you are allowed to write a paper of 5,000 words or maybe more by some journals, you can expand your introduction. So in that context, we'll discuss how the introduction writing different differentiates in different types of manuscripts, and in the end we'll be able to analyze the common errors in introduction writing. Those common errors would be um, the flow of your writing. The writing is not fluent, and the sentence are truncated or broken, or basically they have poor grammar, or the sentence structure is not scientific. So in that context, we'll see what are the different errors in introduction writing. So what is medical writing? Being a clinician or a healthcare professional, or for to define your status, I can define you as a part of big medical fraternity. Although you have not graduated, but you are part of that fraternity, and you are becoming a doctor. So as a student, as a medical student or a healthcare professional who are qualified, they all need to communicate their findings or communicate their observations, whatever they are making during their clinical pursuit, to the bigger world. Because you need to communicate your findings, there must be a uniform structure how to communicate that finding. And that structure must be scientific, and must be uh, logical, must be easily understandable by the masses. So the definition: communicating clinical and scientific data for a varied audience. That varied audience include many people. That may include your professor, your peers, your colleagues, medical students, your faculty and staff. Maybe it includes the nursing staff, the allied healthcare staff, maybe the engineers who are having some interest with the clinical profession or biomedical thing, or biomedical engineers especially. Maybe your audience include the policymakers, the lawmakers, because if you are writing something that has policy implication, your writing must be understandable to the policymakers, so that they can, maybe they can take actions on your recommendations. And it happens not often, but it happens that medical papers give direction um, to the lawmakers. So your audience include physicians, nurses, allied health professionals, pharmaceutical companies, obviously, other scientists, and even the general public. Yes. Why? Because the general public or the patients and their attendants are the ultimate beneficiary of whatever you are observing, whatever you are sharing, whatever you are communicating. So, although those general public, the general patients and their attendants are not well versed with the jargons of medical writing, but to some extent, your writing must be digestible to those general public. In that connection, the part of your manuscript, or the part of your publication that must be in the layman English or simple plain English, that section is your conclusion of your research publication must be very simple and understandable to a common person or simple layman English. So this is about the medical writing. So we are sharing our information, whatever we are observing and finding, as an outcome of our research, in logical and precise manner. However, Medical writing versus literary writing. Obviously, in the literary writing, you use most of the time you use more of the adjectives, the emotions, the artistic things, and you try to attract your audience with certain non-scientific methods. Those non-scientific methods are not allowed in medical writing, but in literary writing they are okay. So the main difference is you are logical and precise in medical writing, while in the literary writing you are not. Before continuing to this slide and the follow on, um, I would say if there are any questions, I would like to take the questions in the end. I'm aiming to finish this lecture within 30 to 40 minutes, and the last 20 minutes or so I'll keep for question and answers. Because you are in fourth year of MBBS, you must have specific clear questions regarding medical writing, and I'm happy to answer all those questions here. However, in the end, I'll share my email address as well, where you can send brief queries, which I can respond to on emails. Please try to put up questions which are of communal importance, general importance. If you have any question which is very specific to your own problem, then I would prefer that question would be emailed to me, and then I can answer it. Okay. So whenever you write uh, what is the procedure of medical writing? When you write for a publication, for an article, that means you already have collected data and analyzed it, and now you are writing it for the publication. But before writing for the publication, especially for the original research, it means that you must have gone through the IRB process, the Institutional Review Board process. And that Institutional Review Board process means that you have, in the past, you have prepared a synopsis where you have written the introduction and other things, the methodology of your proposed project, and on the basis of that methodology you have collected some data, and now you are going to publish. So in contrast to the writing for the synopsis and writing for the medical publication, there is a difference in the order of which section you will write first. So first, medical writing for medical publication. What is the order? Because you already have done the methods, you will write the methods first. Methods first in your own notebook or on your computer. When you send that whole manuscript to the journal, the order would be IMRAD. IMRAD. um, some people say that my slides are not visible to them, although on my screen it's all okay. And okay, let's see. And if that problem persists, I'll Dr. Geti, is this a problem? It's all okay. So yes, thank you, Dr. Geti. I think, dear students who are not able to view my slides clearly, that's a very simple template. So try to you can connect again, and you can restart your computers. Maybe there would be a technical glitch. So however, I'm sorry about that if you are not able to see it clearly. All right. So writing for a publication. when you write for a publication, to organize your thoughts and organize your process, and to write an effective introduction, you write in this preferred order. That's not a rule to write in this order, but that's a preferred order. Because you already have written the methods, so you write the methods for the publications again. And because you have more grip on the methods section, you write the methods impeccably, right? Once you have written the methods, you write the results, because methods and results are more connected, interconnected. So you write the results section after the method, and after the results section you write the discussion and conclusion, because the background, the introduction of your whole research is in your mind. Why? Because you already have written it for the IRB process, or for the at the time of proposal submission. So because you know the introduction and background, you write the discussion and conclusion based on your background, whatever you have in your mind. Once it is done, so then the introduction follows all these sections. When you write the introduction after these three sections, method, result, discussion, and conclusion, it helps you to write an introduction section which is more coherent, more to the point, whatever the problem you have studied, and your writing is more focused, especially in the introduction. just just think about it. Whenever you publish something, a medical paper, a research publication, what is the thing that people read first? Your title. So your title must be very specific, still very reflective of all of your the whole of your paper. So you write the title at the very end. You can edit it according to whatever your findings are. Maybe initially you put up a title X when you were writing synopsis, and at the end, when you have all the results and findings in front of you, and you found that the results are going into some other direction, some y direction, then you create or devise a title which is more reflective of that y direction, and that title would be more reflective and more attractive uh, for the audience or for the readers. One misconfusion I would like to clear here is, whenever you write a synopsis or proposal for IRB permission, that proposal may or may not be may or may not be sufficient for just one medical publication. It may happen that on the basis of just one research proposal which you have got approval from the IRB, you prepared two manuscripts, two different types of manuscripts on the basis of that data. So it may happen that your ultimate your your title of your research may be very different from the title of your synopsis or project. So method, results, discussion, conclusion, introduction, abstract, and the title. Abstract is at the end and in the second last on this list, because in the abstract you need to tell the reader about the I, M, R, and D. Introduction, I for introduction, M for methods, R for results, and D for discussion. So discussion is shrink to just conclusion in the abstract part. So the abstract is most commonly abstract is just most of the journals allow you not more than 300 words or maybe 250 words. Some journals, I have seen some journals won't allow you more than 150 words. So you must be prepared at the time of publication that what are the journal's requirement. Whenever somebody asks me how lengthy I should write my manuscript or what are the word count, I always refer them to the to the respective journal they are aiming for. If you are aiming for JCPSP, Journal of College of Physician Surgeons Pakistan, a very reputed national journal, they won't allow you more than 3,000 words in your original research article. If you are aiming for PJMS or JPMA, they still have this restriction of 3,000 words. So, but some international journal may allow you up to 4,000 words in any original research article. By original research article, we mean that you are writing on the basis of your own data and findings. You have collected data and findings, and that data and findings are of sufficient size, which can be presented as an original research paper. Right. So up till now, we were discussing about medical writing for publication. However, when you write for proposals, protocols, for the purpose of getting approval from some scientific committee or your institution or ethical review committees, in our DUHS we call it institutional review boards. They you write in this manner, that you write first introduction, methods, and then present it to that committee. Still, all those writing must be very logical. So, coming to our second objective, when we discuss that what are the different types of medical writing. Broadly speaking, we can differentiate medical writing into two. We can classify broadly into academic writing and writing for marketing purpose. And you are well aware that medical writing for marketing purpose means pharmaceutical industries are involved. So for the pharmaceutical industries, if you are making presentations or posters or any material, teaching material, which the medical representative use in the clinics to educate the doctors or to enlighten the doctors, all those materials are called medical writing for marketing purpose. Similarly, the health magazines are also considered as for marketing purpose. So, for example, if there is a new product, you as a doctor has been appointed in a big multinational pharmaceutical industry as a director or lead for marketing. You are national marketing manager, and now there is a new product for calcium supplementation, and you want and the company want to roll out that product to at national level. So you as a doctor, you can understand what are the needs of the patient, and what are the plus and points of that product, because you are the director of that company. So now you can devise a very good campaign or a teaching material or a kind of selling material for that product. Okay, right. So coming to the academic part of the medical writing, the academic part of the medical writing can be classified further. One type of academic writing is one that we are dealing with in the DUHS or in any medical university, which is we are preparing brochures for the patients or conducting CMEs or making any patient education materials or publishing our papers in peer-reviewed journals, which are supposed to be read by the general public as well, because they are openly published on the internet. So all those things, and monographs, the one written by an author, all those things are considered um, as pure academic writing. So monograph may include some encyclopedia type of things. Similarly, on the other hand, academic writing may have other aspect that's called the regulatory and protocol type of thing, dossier type of thing. What is that? It is more concerned with the with the regulatory bodies or the government or non-governmental bodies which publish some guidelines for the doctors or maybe for the general public. For example, the NCOC, National Command and Operation Center in Pakistan for COVID-19, they time to time they publish the guidelines for Corona SOPs. So those kind of guidelines are for the general public as well as for the doctors, and those are come under the heading of regulatory or protocol thing. So um, anything you write as a guideline for the masses under the banner of under the umbrella of some regulatory body, that's called regulatory academic writing. And dossier means a collection of multiple things. For example, we prepare a dossier of prevention, treatment, and consequences of COVID-19. So we combine all those 3 4 sections as a dossier. That dossier maybe can be sufficient for healthcare professionals as well as for general public. So coming to the very topic, the introduction writing. What is introduction writing? What you do in introduction writing? So your introduction is the introduction section is the first part of your manuscript, which the reader usually read after reading the your title. And if the title is attractive, then the reader will go to read further. So your introduction must be very fluent, coherent. Coherent means your sentence, the one sentence is connected to the other sentence, and the second sentence is connected to the preceding sentence, and you have a logical flow from known to unknown, so that reader will feel that he is or she is getting something or somewhere out of your writing. So in the introduction section, most of the there are many school of thoughts for introduction writing, but for introduction writing I would advise you to structure your introduction section in at least 4 paragraphs. The 4 paragraphs, the first paragraph will tell the reader what is known about the topic, what is the burden of the disease, what is the severity of the disease, or what is the severity or burden of the condition that you are talking about. It is not necessary you always write about the disease. You may write about some risk factor. You may write about some other things, some other conditions which are not disease but related to disease. So in the first paragraph, you write about the magnitude, the burden, the severity of the condition, what is known. In the second paragraph, what is not known about the topic. And the third paragraph, what gaps you are going to fill in. And in the fourth paragraph, you tell the reader that why this research is important or was important to be conducted, why you conducted that research, what was the or what will be the impact of this research. The impact of the research may be in the monetary terms, that my research will save millions of rupees or billions of rupees, or my research will save lives. The benefit could be in the form of reducing mortality, morbidity. So it could be in the terms of monetary, or could be in the terms of morbidity, mortality, or it could be in terms of reducing the number of hospital days. For example, if someone is is writing a research on some better surgical technique which can enable patient to be discharged within 1 day of surgery instead of 3 days or 4 days of hospital stay, that's a benefit, because you can minimize the hospital acquired infections and you can minimize the agony of being in the hospital. being in the hospital is not a nice thing, even if the hospital is of very good quality, of 5-star type of qualities. So in the introduction, you in all those four paragraphs that I just told you, in all those four paragraphs you will organize these 6 points. What is the problem you are trying to solve? So try to tell the reader what problem you are. So that part would be in the most probably in the third paragraph. So, and are you proposing or are you having any solutions? So tell the reader, this is my proposed solution. If you are not proposing any solution, then you can tell the reader that some other researchers have proposed solutions, and if those solutions are valid or not, you can comment on that, and you can tell the reader what is the best solution, the limitations, and then you will outline the weaknesses and strengths of, but in very brief manner. So being brief is the key. If you are brief in writing introduction, it's expected your introduction would be good enough. There would be less errors, there would be less grammatical errors, and there would be your if your sentences are brief, I mean short, less than my preferred length of sentence would be less than 20 words. A sentence must not be lengthier than 20 words. But some other authors or some other experts advise you to even shorter than 20 words, maybe less than 15 word sentence. So that's dependent on the writing style you are having. Try to limit yourself the limit the length of the sentence within 20 words at least. So if you are not sure of what type of writing style you should choose, or what type of referencing style you should choose, always always go back to the guide for authors for the journal which you are aiming for. That means, it means that whenever you are writing for publication, you must have the journal in your mind, which journal you are aiming for. If you are aiming for BMJ, you have to write according to their guidelines. If you are writing for Lancet or American Journal of Public Health or some Pakistani national journals, you have to follow their own guidelines. So your writing uh, must be in according with their uh, guidelines. So in the introduction section, for example, I'm talking about the third bullet. Try not to make this section into a history lesson. So what does this mean? It means that when you are writing introduction, you need to be very clear that the topic that you are writing, is it um, to a good extent understandable to the medical fraternity and the masses. If it is, for example, diabetes mellitus, every 10 or 15% in Pakistan is having diabetes. The prevalence is so high. In any home, you can find at least one person with impaired blood sugar level. So, in that context, diabetes mellitus is a term which is known to many people, and the doctors as well, the healthcare professional as well. That means you don't have to write or start your writing with diabetes, the definition of diabetes, and blah blah blah. You can just quickly come to the point, what point in the under the heading of diabetes mellitus, what you have actually done. So come to, for example, if your research is about the foot infection in diabetic patients, so directly come to the point in the very first paragraph that foot infection in the diabetic patients is a common problem. Starting with this sentence may be a useful start, right? So don't write the details. Don't write that diabetes is a disease which was common 20, 20 years ago, or so on. So you have to write, you have to cite all the original work, not all the original work, but the original work which has been conducted in the last 5 years. So you have to put up the references which are new, recent, and valid. The quality of references, you can assess the quality of references using the Equator Network website. Equator Network website, and they have different guidelines for assessing the quality of different types of papers. You can consult that website. But you need to be very limited in your citations. You cannot put 100 or 50 references in your original research paper. Most of the journal won't allow you more than 25 references, and some journals won't allow you more than 20 references. So limit yourself, aiming the higher limit as 25, not more than 25, and be prepared to reduce that 25 list to 20 or under 20. So, in the introduction, you don't only write or cite those references which are in favor of your topic, but those references which are against or contradict your theories or your topic, just to present the balanced version of the thing, of the topic. So, while writing, the core is three C's. The three C's are clarity, conciseness, and correctness. And for all of those three C's, I can suggest you one solution. And that solution is be brief. If you limit yourself within the word count and you try to be brief and still very, very, what I say, brevity is the better term here. Your writing must have brevity. If it is brief, still it is conveying the message. So that brevity will bring the clarity, and your writing would be concise, and hopefully it is correct, because you are writing less with much brevity. So write, remember these three C's. What are the enemies in writing? Repetition. Repetition is your number one enemy. So most of the time, especially in the thesis and dissertation, when students are exhausted of ideas and sentences and other things, what they do, they repeat the the concepts and the ideas they have already described in the previous chapters. Don't do this in your research paper, because research paper is just a small part or a small manuscript which is readable in just one go. Within 20 minutes, a good reader can read and understand your research paper. If you are repeating ideas, concepts, phrases, words, or your data and findings, that would leave a very bad impression for the editor. And if, in just in case, if it is gone through with the editor, it will leave a bad impression for the reader too. So repetition and redundancy is a big no. Ambiguity. Ambiguity is you are not giving sufficient detail to the reader to understand what you are talking about. I'll come to that ambiguity in a later slide. And you have to present your findings and whatever the introduction, whatever the medical writing you are doing, in transparent manner. You don't have to undermine or exaggerate. You don't have to say that I have done that much big work that it requires a Nobel Prize, or it I can claim a Nobel Prize. You cannot do that. because um, uh, publishing in a medical journal means that you are open to peer review. If you are open to peer review, your peers are expectedly more intelligent than you or than me as well. So if they are more intelligent, they can understand what is the status and what is the worth of our writing. So there is no need to exaggerate. Your writing will speak it yourself. So if you can focus here on the third bullet, a writer, an author was writing. In addition, I'm quote unquote, I'm reading their own writing, the author's writing, quote unquote. In addition, a systematic analysis of the data was also presented. After statistical analysis of the data, the methods were then modified. So systematic analysis, and then in the next sentence we are again referring back to statistical analysis, and then we are telling that the methods were then modified. It means that we are repeating and making a cyclical process of the medical jargons. That's not on in the medical writing. There is another thing called circular sentences. This circular sentences you can understand with this first bullet. In order to compare the quote unquote, in order to compare the differences in the two analytical methods, the dependent variable was set to concentration in order to determine if changes had occurred. So the here in this first example, in the first bullet, the author who wrote this sentence, these are just examples. The author who wrote these sentences was using a medical jargon repeatedly to to facilitate the reader to go back and refer to whatever the concepts they have mentioned in their previous sections. But although the author is apparently trying to facilitate, these circular references or circular sentences are not facilitating the reader. I'm reading the second example and you can understand better here. Calcium regulated transcription has a different meaning from calcium regulated transcription. so these kind of confusions are a big kill for medical writing, and authors are advised not to use the same cyclical sentences, so that the reader will be lost and they won't be able to understand what the meaning of that sentence was. The third example I'll read. To identify biomarkers of prostate cancer, we perform microarray analysis using custom cDNA arrays. So you can see in these examples the problem of using same medical jargons in the beginning and at the end of the sentence, which makes the sentence as a circular sentence. Avoid this circular sentence problem. So coming to the ambiguity. Quote unquote, the example I read here, data were normalized to the internal reference housekeeping gene actin, which showed, and the author is not telling the reader here is by which, the term which is referring to what. So the better sentence would be, data were normalized to the internal reference housekeeping gene actin, revealing that, or perhaps then you will tell the reader the term which include this and this things. You cannot use etc. in the medical writing. You have to write precisely what you mean. So I'm not, there are many examples on this slide, so you can read it on your own. I'm moving to the another slide. Grammar and tense. I hope you are well versed, maybe better than myself, in the grammar and tense thing. You need to keep your tense in active manner. Active tense is preferred. And in the grammar section, you will write, um, so your tense, sorry, your voice would be active voice, and your tense would be dependent on you are writing, what section you are writing. In the introduction section, you can write in the present tense, or and in the method section, you can write in the past tense. Right. So the bottom two examples, where my cursor is, the proportion of various monocyte surface markers were 45, 46, 45, 63, and 70% respectively. The correct sentence may be, the proportion of monocytes positive for CD163, CD7, and CD11A were this, and this percentage respectively. In the first sentence, which was incorrect, here this respectively, which this respectively is referring to what, which was not mentioned in that sentence. In the bottom sentence, this respectively, the term respectively is referring to these three genes, CD163, CD7, and CD11A, which must be mentioned in such sentences. So um, your abstract, we talked about the abstract, because this is not exactly the objective of this lecture. So I'll tell you briefly that in the abstract you follow the IMRND, as I told you in the beginning. Introduction, just 2 lines of the background of your study, because you have to write within 250 words at max. Methods may take 100 words. Then results would be around 100 words or more. So you mostly, your methods are elaborated in the abstract, and results are a bit smaller than the methods, just to attract the reader to read more of your article, your full article, and the conclusion would be 1 or 2 liner. So your title would be within, I would say, within 20 words, or maybe shorter than that, but it is based on the guidelines provided by the journal. So your title must be reflective of your research objective, as I told you in the previous lectures. So your title, research title, would be reflective of your research objectives, and it is specific and concise. By concise, we mean that it is to the point, reflective of the objectives, and within 20 words. And you cannot use any abbreviation in your title. You should not use jargons just to make it more hi-fi or sci-fi type of thing. Don't use ambiguous terms, non-standard terms. That's not uh, good. In the end, you can use some English editing services, which is optional. But the English editing services, there are thousands, hundred thousands of different English editing services online. These English editing services, which are mentioned here, are recommended by Elsevier Publishing, Elsevier and Springer Publishing. So these are recommended by Elsevier Publishing services, but not, uh, so it's not a mandatory thing you use English editing services. But some of the journals, when you submit to them, your when you submit your papers to them, they ask you to use some English editing services, just to make your writing style more uniform with the journal's guideline. However, if you at the beginning, if you follow all the journals, if you follow the guidelines and the rules of that specific journals very properly and completely, I hope you won't be referred to any English editing services, and your article would be accepted in that journal as it is. These are the references which I would like you to refer to, which I use to prepare these slides. And thank you very much for your patience and concentration in this lecture. And the forum is open for question answers. I'm starting with the first question that was put to me. Okay, as to, was to make slides, and they are saying we can't see properly. Please make the slides. Okay, it's too big. Okay, you can see it. Okay, we can see it, but it's too big. Okay, free. Okay, thank you very much. Who was that? Um, yeah, you are right. The Palestine and Gaza thing, but I understood, and we all understood. Questions in the end, yes. Um, thank you. Okay, if there are no questions, I would like to end the lecture here. The 4 tiers. If you still have any question, you can email me, or you can pop into my office with all Corona SOPs. Maximum 2 people allow at a time, and we can discuss it further. Dr. Geti.
Okay, sir.
Um, I'll wait for a couple of minutes more, just in case if there are any questions. If not, then we'll end the lecture. And I would like to thank you as well for moderating this
You're
lecture.
welcome. You're welcome.
Yes. Okay, there are questions. Okay, so the question is it possible to publish two separate articles if only one IRB was obtained? Yes. IRB is obtained for a research project, and if that research project is rich, by rich I mean if it has many variables and many aspects and multiple objectives, then yes, you can publish not only two papers but multiple papers. For example, if you have obtained an IRB for a follow-up study, for a longitudinal study, and that study is going on for 1 year, 2 year, 3 year, 4 year, you just every year you just submit the progress to the IRB and you get a renewed permission. You don't have to get the permission again. So out of that project you can write as many papers as you can. If the data is fresh and data is new, you can write different aspects. Okay. Thank you for the question. Who was that, by the way? Um, Sakina Mansur. Okay, Sakina, right. Thank you for that question. Thank you very much, Nadine. Thank you, Aisha.
Thank you,
Thank,
sir, and thank you, students.
thank you very much. We are ending the lecture here. Thank you, Geti, for moderating. Bye. Allah
You're
Hafiz.
welcome.